Hi, everybody. Good afternoon. It's Senator Maria Collett, and today I am really excited to be hosting an important discussion about healthcare and Pennsylvania's new health insurance marketplace called Penny. As a nurse and as a legislator, access to quality, affordable health care has been one of my top priorities, and the COVID-19 pandemic has made this issue even more critical. With the threat of this virus, having reliable health insurance is more important than ever. But because of the pandemic, and it brought so many economic issues and large-scale job loss, many Pennsylvanians have lost their insurance when they need it most. In 2019, the Pennsylvania legislature passed unanimous bipartisan legislation to establish a state-based exchange platform replacing healthcare.gov and making coverage more affordable and accessible for our residents. Penny is the product of that legislation, and I'm glad to have a representative here today to walk us through it. That's Zach Sherman, as well as a navigator from the Health Federation of Philadelphia, Hannah Kamara. She's going to talk more about the one-on-one assistance that is available to you. And then Tia Whitaker with the Pennsylvania Association of Community Health Centers is here to give us even more information. So I'm very excited to hear from our three panelists today. We're going to start with presentations from each of our speakers, and then we're going to move into a question and answer segment. So if you're watching us live on Facebook, please leave any questions in the comments below, and we will get to as many of them as we can. So Zach and Hannah and Tia, thank you all for being with us today. I really appreciate it. And I'm going to kick it over to Zach Sherman from Penny to get us started. And I think, Zach, you should be sharing your screen with us, and I can see it, so I hope it's broadcasting live to Facebook World too.
Great. Thank you so much, Senator. Thanks for the opportunity to be here and to tell you all a little bit about Penny, Pennsylvania's new health insurance marketplace. Just starting broadly with who we are and what we do. Penny, our name is the combination of Pennsylvania, Penn, and insurance exchange, i.e., brought together it makes Penny, and our overarching goal and role is to connect Pennsylvanians to health coverage. We do that by being the official health insurance marketplace for Pennsylvania. As the Senator mentioned, we are brand new. We are replacing healthcare.gov, so we are not complementary to the federal marketplace. We are now starting this open enrollment for plan year 2020. We are the only place for high quality, affordable health insurance plans, as well as the financial assistance to help reduce the cost of your monthly premiums, and in some cases, your cost sharing, your deductibles, your co-payments. We aim to help any Pennsylvanian without coverage, trying to access affordable coverage, and that generally breaks into a few different categories, starting with existing customers who have in the past accessed coverage through healthcare.gov. This year, we helped them transition from healthcare.gov to the new Penny program, to the new Penny platform. We also serve individuals and families who don't have coverage through other means, whether it's through their employer or through public assistance programs like Medicaid or CHIP. We broadly want to serve and support those that are uninsured. As the Senator mentioned, access to coverage, access to healthcare when you need it is important always, but definitely so during a public health pandemic. And we also serve those that come to us who actually are eligible for other programs, such as medical assistance or CHIP. If you come to us, apply for coverage, and are income eligible for no-cost coverage through the Department of Human Services, we operate a no wrong door policy. It can help facilitate the process of getting enrolled into Medicaid or CHIP. We help in a number of ways. We have a dedicated customer service team. We have a number of online self-service tools. We've vastly expanded outreach and education with this new program across the Commonwealth. And there's two representatives of Navigator, a sister assisters here today, so I'll let them talk about that. But we partnered with both assisters across the Commonwealth as well as brokers to provide specialized enrollment support as well as education and advice around plan selection. I won't spend too much time talking about how we got here because the Senator already touched on it, but the Commonwealth, through a unanimous bipartisan vote, voted to create Penny. They also voted to create a program to reduce the cost of individual market coverage. Those things together came at no additional cost to Pennsylvanians, and what we got out of it was flexibility to react to changes to serve Pennsylvanians, to serve the residents in the best way for them, local control of our operation, customer service, education. We saved money. We invested that money into premium savings. That is already paying off starting in 2021. Premiums are the insurance department recently announced that premiums are going to be 5% lower on average than they would have been across the market, across the state. We got the ability to work closely with insurers to foster choice in a competitive marketplace, as well as other state agencies like the Department of Human Services. A couple critical milestones I want to highlight for you. The first is that we've extended open enrollment. A benefit of being a state-based exchange is our ability to set our own enrollment period. So this year, open enrollment is a month longer than it's been historically, and runs through January 15th. Within that are a couple of key deadlines that I want to highlight. The first is coming up on December 15th. We urge you to come in and get covered, to get enrolled by December 15th. That will allow you to sign up for January 1 coverage. So if you want to have coverage starting right in the beginning of 2021, you need to come in and get enrolled by December 15th. If for whatever reason that doesn't happen in between December 16th and January 15th, you can still come in and get signed up. You're just signing up for February 1 coverage. This slide just very briefly gives you a visual representation of where the uninsured are across the Commonwealth. This is based on 2018 data, so it doesn't have any more recent impacts because due to COVID-19, but I would say it's very representative and illustrative of where the uninsured are across the Commonwealth. The darker green counties represent higher groupings or a higher number of the uninsured. So you can see in the southeastern part of the state, there's quite a few, the Commonwealth has done a great job of reducing the rate of the uninsured, but there's still some work to be done, and there's quite a few folks in the southeastern region of the state. Just a little bit about the customer experience with Penny, starting with existing customers, those transitioning from healthcare.gov. We felt very strongly that it was important to facilitate a easy transition from the federal marketplace to this new program. If you were enrolled in a plan through healthcare.gov and that plan is available to you in 2021, you will be eligible to renew into that plan automatically if you'd like. If for whatever reason you're interested in shopping around, you have the ability to do so. And lastly, we urge folks to come in to claim their account with Penny and to make sure that all the information we have related to your eligibility and your application status is up to date. So if you got married or your income has changed or you've experienced some sort of other life-changing circumstance, come in, let us know through the application process, because you may be eligible for more financial assistance than you have been historically. There's a number of tools that we have available to Pennsylvanians to facilitate the enrollment process. The first is if you're not sure and you just want to check out your options, you can do so without creating an account. You can anonymously shop. You can apply for coverage online. You can apply for coverage over the phone or with navigators, assisters, or brokers. We provide, again, financial assistance. So the application process allows you to see how much you are eligible for. We have tools that allow you to do an apples to apples comparison of your plan offerings. It also allows you to filter by things that are important to you, whether it's your insurer or your monthly cost or your potential total out-of-pocket cost. There's a number of ways in which you can filter your plan offerings to allow you to make the best decision for your health needs as well as your financial needs. Of course, you can then shop for your plan, and to stay covered or get covered, all you have to do is pay your first month's premium. Just a little bit about eligibility. To be eligible to enroll in coverage through Penny, you need to be a resident of the Commonwealth, and you have to be in this. You either have to be a citizen, or in this country, you have to be lawfully present in the United States. Again, we are the only source for financial assistance to help pay for coverage. It's really worth coming in and checking it out. 9 out of 10 of our customers are eligible for some form of financial assistance, and in some cases, it's very significant. So we really do urge you to look at your options. And a little bit, the next slide talks a little bit about the 2 types of financial assistance available to you. One is a premium tax credit that gets applied on a monthly basis to your premium. Eligibility is based on your household size and how much money you make. But a good rule of thumb is if you're an individual who makes less than $51,000 a year, or a family of 4 making roughly under $105,000 a year, you're going to be eligible. You're likely to be eligible for some sort of financial assistance to help pay for your coverage. And as you can see on the slide, it's quite a bit. On average, customers are seeing over $500 in savings per month. And lastly, on the coverage that we offer, we offer plans from existing commercial health and dental insurers across the Commonwealth. Who offers the plan in your region it changes based on where you are in the state, but all of the participating insurers that we've seen in previous years are offering in 2021, and a couple are expanding their reach across the state. All of our plans have to cover the 10 essential health benefits, and the consumer protections that have existed historically. You cannot be denied coverage because of a pre-existing condition. You cannot be denied the ability to renew in coverage because of a pre-existing condition. And another example is if you can be on your parents' plan until you turn 26. All of those protections exist through the coverage that we offer. And the last thing I wanted to touch on is the different ways we can help you navigate the process. I've talked quite a bit about our online tools. There's a lot of information on our website. There's tools on our website. Our website, it's penny.com, pennie.com. Come in, check us out. If you need any sort of navigation, customer service support, if you want to talk to somebody, we have a dedicated call center staffed by trained and certified customer service reps who can help you with the process. They can help you navigate the application. They can help you understand the plan offerings and financial assistance. If you have a question, give us a call. They can also connect you to Penny certified insurance brokers who are certified and licensed to provide enrollment assistance and advice on plan decision, on picking a plan. So if you want support around the right plan for your health needs, your budget, brokers can help you with that. We also have a number of partners across the Commonwealth in the form of assisters who you're going to hear from a little bit later, so I won't talk too much about that, but they provide in-person and virtual enrollment assistance support as well, and we can connect you to those folks as well. Our call center hour of operations are here on the slide. We're we're in the midst of open enrollment right now. So from Monday through Friday, from 8 a.m. to 7 p.m., we're open. Give us a call. And we're also open on Saturday from 8 a.m. to 1 p.m. And lastly, this slide is just, how you can help spread the word about Penny, about open enrollment. Our social media handles are listed on the slide here. Please feel free to share and promote and boost the information that we're pushing out there. We also have a number of social media and messaging and communications tools available to promote open enrollment, to promote Penny, including newsletter language and like branding content, information available to you. It's on the URL listed on this slide. And lastly, we have a couple work groups that are an opportunity for anyone who's wants to get involved, to provide feedback about how it's going, about what's going well, about what needs improvement. We have the outreach and education work group that meets on a regular basis, and that's open to anyone who wants to get involved. So feel free to come in and sign up. So that is my overview. I'm happy to take questions now or later, Senator, whenever works.
Thank you so much, Zach. And I think we're going to do questions a little bit later after we hear from Hannah and Tia. So I want to turn it over now to Hannah Kamara. She is from Health Federation of Philadelphia. She's a navigator there, and she's going to give us some more information. So Hannah, the floor is yours. Thank you.
Hi, everyone. Just briefly kind of talking about, I've been doing kind of the enrollment assistance since OE1. So I'm super excited that we have our state platform. I've been going through it since the beginning and it's running pretty smoothly on our end. So I am out of the Philadelphia Southeastern region, so able to help in Montgomery, Bucks County, even the whole state, but definitely with these constituents here. And any questions, feel free.
Great. Wonderful. Thank you. Oh, let me turn my camera on so I can say hello to the people. Sorry. Tia, and I want to welcome Tia Whitaker as well. She is from the Pennsylvania Association of Community Health Centers. I think I got that right. I see the acronym there, so I think I got that right. And Tia, if you don't mind just introducing yourself and letting our viewers know what it is that your organization can help with, that would be great. Thank you.
Sure, Senator, thank you so much. So my name is Tia Whitaker. I'm the statewide director for outreach and enrollment at the Pennsylvania Association of Community Health Centers, which is a mouthful. But our organization, PAC, has been providing enrollment assistance through our community health centers and partner organizations since 2013. We bring a coordinated statewide approach to in-reach and outreach and enrollment when it comes to the marketplace and medical assistance at our more than 300 health center locations. We also offer quality, affordable health care for all, regardless of insurance status or ability to pay. So the great part about it is we can help folks throughout their continuum of insurance or even uninsurance. We provide free, unbiased enrollment assistance. Our enrollment assisters are trained, certified, and licensed to help support customers either in person, telephonically, or virtually, and walk them through the application and shopping and purchasing process. Our information can also be located on penny.com, along with a host of other organizations that can provide enrollment assistance. It's important to get coverage, but it's also important to know how to use it and where to go to use it. So our organization is there for consumers.
Wonderful. Thank you so much. And thank you all again for being here to help us sort of navigate through this process, pun intended. So I want to start with some questions that we're getting. The first one is that if I had exchange insurance last year, do I need to re-enroll? Anyone can take it.
Yeah, so I'm happy to start. So if you were enrolled in coverage through the federal exchange through healthcare.gov last year or this year, 2020, your information, your enrollment should have been transitioned over to our program, to our platform. And if the plan that you were enrolled in is available in 2021, which most of them are, we would have facilitated the process of automatically renewing you into coverage. Now, there are unique cases where potentially we need more information from you, or that plan doesn't exist next year. So it is always important, I think, for you to take a look. We should have sent you a communication for you to call us or to come in and capture your account. You can come in and claim your account with Penny, and all of your information should be in there. So the plan and approach, and much more likely than not, then you were automatically renewed, but we still urge you to confirm that. Give us a call, go to penny.com to just put in a little bit of information and confirm that you've been renewed into coverage. And again, the assisters, PAC or Hannah, can help investigate that, take a look at that as well.
Wonderful. Thank you so much. And it sounds to me like that website, penny.gov, I want to make sure I get it right, is the best place to go to sort of start getting information that you might need, and then building off of that from there. Also, it sounded to me, Zach, like consumers will get correspondence so that they know that they are now going to be directed to Penny instead of healthcare.gov, which is really wonderful information as well. So I appreciate that. Thank you.
Yep.
Another question is, can I enroll for everyone in my family? Tia corrected me. Thank you. It's penny.com. I'm so sorry. Penny.com, everyone. Thank you for that. So the next question that we're getting here is, can I enroll for everyone in my family?
Yep. Yes, you can. We enroll households. Obviously, everyone in your family has to be eligible for coverage, but as long as everyone's eligible for coverage, then you can enroll your entire household.
That's great. I appreciate that, because I think one of the things that we get sort of confused about, or we want to make sure we have the right information about, is whether or not each eligible adult has to enroll. But if a member of the family can enroll for the family, then that's really great to make sure that we have coverage going forward. So thank you for that. Wonderful.
Yeah, and there are circumstances where a family that has children might have kids that are eligible for CHIP, no cost or low cost CHIP. So there may be circumstances where you have to get your kids enrolled through CHIP, and the adults will enroll through Penny. So it's not always the case, but of course the CHIP program is wonderful, and oftentimes is a no cost or very low cost choice for families as well.
Thank you for that distinction. I have family members who that is the circumstance for, so I really appreciate that you made that distinction. Hannah, I see. Do you have something you'd like to add?
I was just going to add that on Penny, you can enroll there, and then the system will kind of deem if you would go to CHIP or Medicaid for that household, or if they would stay on Penny.
Oh, that's great. I always like it when I get a direction. This is what you need to do. Thank you. I appreciate that. What if my income changes significantly in 2021? Will my premiums change?
Yeah, so financial assistance eligibility, the amount of premium tax credit that you receive is dependent upon your income. And first of all, we always urge people to give us the most updated picture of your income, because we want to make sure that information is right. But yeah, the long and short of it is, if your income goes up, your financial assistance is likely to go down. If your income goes down, your financial assistance is likely to go up. And if it goes down to a certain point, to the point where you're eligible for medical assistance, you actually might transition from Penny commercial coverage to Medicaid medical assistance through the Department of Human Services. So income changes are always a good thing to let us know about, because we want to rerun things and make sure that you have the most up-to-date picture about what you're eligible for, what your premiums are, and what your options are.
And the wonderful part about the Penny.com website is there's an estimator tool. So we have had consumers who have called in and said, you know, I'm looking to retire next year. I'm not really sure what my income will be. They can go on Penny.com and put in different numbers so they can estimate what their premium will be.
That is really helpful. And I think especially as we see people transitioning from 2020 to 2021, things really changed for so many of our families and our communities as a result of everything that happened with COVID. And so as we move into 2021, it's really wonderful that that tool is available on Penny.com so that people are able to, you know, effectively determine what kind of coverage they'll be able to get and, you know, where they'll fall in the spectrum of that. So I appreciate that. Thank you. I have another question here. If I'm currently unemployed and I sign up for ACA, will I lose my credits or need to pay them back if I gain employment in 2021?
So when you enroll and when you're eligible, you know, if you're unemployed and you enroll and you're eligible for financial assistance, the credits to help pay for coverage, as for the time period when you don't have access to coverage through your job. So if you get a job later in the year and coverage through it, at that point in time, you would discontinue being enrolled through Penny, and you would go forward with your coverage through your employer, but you're not going to lose it retroactively. It's just as soon as you get other coverage, then you leave coverage through Penny, but you would not be subject to paying those credits back as a result.
Great. Thank you very much. Another question for all of you. I'm just going to keep going here. Will there be other opportunities to sign up for healthcare coverage in 2021? Zach, I think I heard you saying this during your presentation, but I'm not sure if I was correct. I think I heard you say something about February 2021, but please help us make sure that we understand when we're able to sign up for health coverage.
Yep. So there's a annual open enrollment period where anyone can come in and see if they're eligible and get covered. That period runs from November 1 through January 15th. And we extended it by a month this year. It's longer than it's been in previous years. If you enroll after December 15th, you'll be signing up for February 1 coverage. So that's where the February 1 date came in, Senator. But, you know, we're urging people to come in right now to get covered. Outside of that annual period, outside of that annual open enrollment period, you're not eligible to come in and get enrolled unless you experience some sort of qualifying life event. And an example of that is if you have a kid, or if you get married, or if you move from one part of the state to another, to a different service area, or if you lose coverage through if you lose your job and your employer coverage. All of those are qualifying life events, which trigger what's called a special enrollment period, where you have 60 days to get enrolled through Penny during that time period. So for everyone, open enrollments right now, come in, get covered. Outside of open enrollment, if you experience some sort of qualifying life event, we give you a special time period to come in and get covered if you're uninsured.
Great. Thank you very much. And then I guess one of the questions we've gotten is about documentation needed to enroll. So if you have that special enrollment circumstance, I suspect there's also documentation that goes along with that qualifying event as well.
It depends on the circumstance. Sometimes for some of the more common ones, we take self-attestation as the verification of the event. So and some of those qualifying life events are hard to document, and we don't want documentation to be the thing that gets in the way of you getting covered. And so, for example, losing your job that's kind of losing your job-based coverage is kind of a hard thing to document. So we take self-attestation for that sort of thing.
Wonderful. Well, thank you very much. That's really helpful as we try to help people navigate through this. I have another question here that's popped up. If my adult child lives with me and earns an income, do I need to include their income with mine when I apply?
I've kind of been hogging the mic, so if Hannah or Tia, if either of you want to take that one, I'm happy to go as well.
So the question was, if your adult child lives with you, do you have to include their income on the application?
Correct, yes.
Typically, the response is no, because they would be filing their own taxes separately. So that individual, the parents would not need to include the adult child on their application. The adult child can apply for themselves as well.
I see. Great. Thank you very much. Here's another question. I've seen some insurance plans on private websites that seem to have lower premiums than what I find on the ACA. Can I sign up for one of these? Are they legit? And I'll just give you a personal anecdote here. When my father was living, he lived with me, and every year at open enrollment, he would talk to someone, you know, a friend at the senior center who said, I only pay such and such for, you know, my health insurance. And my dad would say, like, am I getting ripped off? And so we'd go and look at the books and try to figure out if that coverage was comparable to the coverage he was receiving, to make sure that the reduction in price wouldn't cost him more on the back end because of an increase in care price. But that was my personal experience with him, and it happened probably every year. You know, he'd come home and say, hey, I just talked to so-and-so at the senior center, and they're only paying $75 a month. All right, Dad, let's take a look at it. But my dad was lucky. I was a nurse and am a nurse, and he lived with me and had someone to help him navigate through that. Many of our community members don't have that. So can you give us some gauge, some way to figure out if those lower premium prices that people are seeing, are they legit, and can people sign up for them, and what's your best guidance on that kind of thing?
My best guidance is to be wary. It's, you know, the devil is in the details. You really need to make sure that you're understanding what you're signing up for, what that potentially lower premium actually gets you. You know, some of these, it depends on your healthcare needs. It depends on what you want, but some of these plans don't have the same consumer protections or the same comprehensive nature of our plan offerings. And some of these plans explicitly deny you coverage for having a pre-existing condition. Most of them, a lot of them, have caps on annual and lifetime limits. The plans that we offer have note by law cannot have caps on annual or lifetime claim payouts. So I would say the devil's in the details. You really need to understand what you're signing up for. And I would also offer that the financial assistance that we provide to help pay for coverage is only available through us and will not be applied to any of those plans. So there may be wary of comparisons where they show you a plan price offering compared to a full price plan through us, because that doesn't have any sort of accounting for the financial assistance that we offer to make the plan price more affordable.
I also add in too about networks, making sure your providers are in those networks. Sometimes those limited plans or those lower cost plans, the networks can be very limited, or your current providers might not be a part of it. So checking with that is really important as well.
Thank you so much. And thank you both for those responses. I think that's one of the hardest things as people who are consumers of healthcare services, right? We need those services, but we aren't necessarily experts in understanding those plans and all of the nuance that goes along with it. I think that's really helpful information to try to make sure we're doing good comparison shopping And Zach, I appreciate the point of looking at those assistance programs to see if that really does change the price on the front end for consumers. That's really important. So I appreciate those responses. Here's another question. If I don't have insurance coverage for 2021, will I be forced to pay a penalty?
Nope. Short answer is no.
Short answer is no. Good. Good. I think many people are still sort of concerned about maybe some previous rhetoric that we heard about that issue. So I'm glad that we're able to clear that up here. I appreciate that.
And I would just offer, you know, it's personal decision about whether or not to get coverage, but be wary of the prices associated with not having coverage. The implications of catastrophic events. You get in a car accident and you don't have health insurance, you're going to be you're going to have to pay all of those bills associated with those sorts of events. So health insurance itself is a lot of it brings peace of mind. It's protection against the unforeseen. So I would just offer that up. You certainly will not pay a penalty on your taxes if you don't have coverage next year, but there's unforeseen costs that come without having health insurance.
Certainly, and for many of the people that are viewing, many people know that my father was recently involved in an automobile accident, and those bills have been really unbelievably high, but of course for good care that he received while he was in the hospital in the ICU. But just seeing some of those numbers, as I open up those bills is something that really does give you pause. So I appreciate that he had good coverage and that we're able to sort of navigate that process after his passing. So you're right, it is important to think about those other costs as well. Here's a question that we're getting. Will any federal changes to ACA impact my insurance next year? So for example, if I have chosen a policy through Penny and have started to initiate that policy, and then there are changes on the federal level, will they impact the insurance that I have chosen and am paying for?
Yeah, that's a great question. I would say changes that come down from a regulatory, from a new federal administration, generally those changes are not things that impact right away. They give us a little bit of time to implement them. So I can't guarantee anything, but I would say new changes coming out of a new federal administration will likely take some time to go into effect. The other piece is the ACA is being contested at the highest federal court level in the Supreme Court. There was a recent hearing. I would urge any and all people worried about that to know that has no impact on anything going on right now. That was a hearing. Any decision related to it is not likely to come out until the summer, and regardless of the way the decision goes, it will not impact coverage right now. It's not going to impact any health insurance plan that you enroll in for 2021. Those contracts will stay in place.
That's good to know, and I think it gives a lot of people some peace of mind. If we don't know what's happening at that federal level, it's good information to have. What about people with irregular income? Zach, you talked about making sure that I'm updating my income through penny.com as often as I can. But if my income is irregular, is there sort of a rule of thumb, or is there just sort of an estimating point, or is there should I just kind of keep updating as I go?
Yeah, I certainly have an answer, but Hannah or Tia, do you have any tricks of the trade that you offer to consumers around this particular question? I know that's a very common occurrence and a really great question. So you guys are you've been helping consumers on the ground since day one. So just any sort of advice around that, I think I'd love to hear it as well.
With everyone's circumstances being so different, I typically, the advice that I give is look at your finances on a monthly or quarterly basis just to see exactly where you are. You don't want to overestimate, you don't want to underestimate, but you want to make sure you're looking at it periodically. And if there are significant changes, you definitely want to call and let the call center know that your income has changed either up or down during those times when you're looking. But again, I suggest looking at it either on a monthly or a quarterly basis just to make sure you're still on target.
Great. Thank you very much. And I have one last question here. Are there any health insurance or enrollment scams that people should be aware of at this time of year?
Probably, I would say. You know, the annual open enrollment period is always a time when nefarious bad actors try to take advantage of the fact that everyone knows it's open enrollment to go out and try and sell people on something or another. So I would be wary of someone calling you up and saying that you have the, you know, trying to sell you a thing, generally speaking. When you get outbound, you know, when you get someone calling you about that, if you're concerned or you're not sure, feel free to hang up and call us back. You know, call us on the line that's publicly on our website and say, someone just called me from Penny saying they had, you know, free insurance and a Steelers ticket. Is that really you guys? Right? So whatever it is, right? So always, if you're concerned or not sure, the best way to verify is to go back to the organization and ask them if what they, you know, what you were told is actually true. So if you call us on any of our publicized lines, or if you go to an assister or a broker, they're going to help you understand whether or not something is above board.
Thank you. And we do a lot of scam prevention seminars through our office to try to keep people aware. But I know we've all probably gotten those voicemails from a number we didn't recognize that said, I'm calling you about your health insurance, you know, so you're right. Be wary of those. Tia, did you have a comment that you wanted to add?
We always tell consumers, penny.com, penny.com. If it's something outside of that, you know you can compare, but the official site is penny.com. And if you're able to go there, you can find all the information. You can, like I said, do the estimator tool and enroll and get the phone number to talk to the customer service team or to find an assister. But you always want to make sure it's the official website, which is penny.com.
Wonderful. Well, thank you all so much for being here. Before we close out, I just wanted to give each of you the opportunity to let our viewers know how they can reach you or your organization. What's the best way? And we'll put that in the chat for everyone.
I can be reached either phone or email, but by phone 215-977-7255. That's the Health Federation of Philadelphia's Navigator line. So we'll be able to screen and go through that way, or by email at navigator@healthfederation.org.
Great. Thank you so much, Hannah.
Mm-hmm.
And,
Our enrollment assisters at community health centers can also be reached at 1-866-944-2273 or at help@pachc.org.
Wonderful.
And it's been said a couple times, but penny.com, pennie.com. Also, our call center number is 1-844-844-8040. And like you said, Senator, we can share that info and drop it into the chat.
Great. Well, thank you all so much. That's about all the time we have. It's all the questions that we got. So I'm really happy that we made it through all of our questions. Thank you to Zach, Hannah, and Tia for being here today, sharing your knowledge with us, making health insurance a little bit more approachable for all of us. We really do appreciate it. And I'd also like to thank everyone who participated, submitted questions, watched our live stream from home. If you missed the live event, don't worry, the program will remain available on my Facebook page, and it'll be posted to my website, senatorcollett.com/ACA, in just a few days' time, and we'll do that with closed captions as well. So if you need further assistance using Penny or finding the right plan for you and your family, take advantage of our free insurance navigators that Zach and Hannah and Tia mentioned. And you can always reach out to my office as well at senatorcollett@pasenate.com or at 215-368-1429, and we'll be happy to connect you with personalized assistance. Thank you all again for being here with us today. I hope you have a wonderful rest of your day, and I hope that you have a nice holiday coming up. And I hope you get some time to rest and relax with family. And nice to see you all and nice to meet you. Thank you for everything that you do.